Hey everybody, welcome back to Beyond the Bump. I'm Erica B, and today we're talking about blood pressures. I get a lot of questions and I see a lot of patients who have issues with blood pressure either before they're pregnant, of course, during their pregnancy, and then really at the end. I see probably the most issues as far as my patients go. But a lot of people don't know that you can also have blood pressure issues after your pregnancy is over. So we're going to talk about all of that today. I'm going to dig a little bit into chronic hypertension, if you've heard those words used for you, like I have. Gestational hypertension, also known as PIH, which stands for pregnancy-induced hypertension. And then I'm going to go a little bit into preeclampsia, which has been like the topic I've gotten the most questions on. If you have commented or given me feedback, I want to again thank you so much. You guys are why I do this, because I really feel like it's important that we know the signs of complications during pregnancy and we know what's normal. So I really want to help to share that. So we're going to go ahead and get started. Recently, probably within the last, I say recently, but that's probably really been about 10 years ago, the American Heart Association and, other big people who care about your heart and blood pressure changed the normal blood pressure for just a random person every day from 120 over 80 to 120 over 70. So what that means is we're watching a little bit more closely to see the rise in the blood pressures. But if you have normal blood pressure, it should be, I still say 120 over 80 is great. It's way better than mine is on a regular basis. So 120 over 80 is still good. Don't go running to your doctor if it's 120 over 71. It's not that big a deal. But it just gives us a little bit closer of an eye on what's normal and when it should be checked a little bit more closely. So 120 over 70, 120 over 80, both still normal. So let's say your blood pressure is high. Like, for example, if your blood pressure runs 130s over 90s, 140s over 90s, higher than that, persistently, meaning we've checked it multiple times on different days, across different weeks, different months even, and it's still running regularly, running that, then you could be at risk. You're either pre-hypertensive or hypertensive, and that just means that you have a little too high blood pressure. And so we're going to be watching you closely, because things that can happen when you let blood pressure just be high all willy-nilly involves things like strokes and heart attacks and, blood clots and aneurysms and all those scary words, which I am not here to scare you. I'm just here to give you information to empower you to ask the right questions, get those labs done if you need labs, to show up to the clinic or the emergency room if you need to, and hopefully to have a better life. So my story, if you have not seen it, on blood pressure issues, I had no blood pressure issues prior to getting pregnant with my son, who's now 3.5, almost 4. 106 over 53, like that's random, but this is the type of things I remember. Like, these are the normals that I would have. And so I got pregnant with Ellis, and I wasn't really paying attention to my blood pressures because I knew that my blood pressure was going to be fine the whole time. And y'all, if you know any nurses, you know that we are always looking for something to go wrong in our own care, because that's called the nurse curse. And so for me, I knew mine was going to be blood sugar related. Like my mom was gestational diabetic with me, and I was 8 pounds and 13 ounces at birth. And so I just knew, oh my gosh, I was huge at birth. And so I know that that can be genetic. You're predisposed to having blood sugar issues if you were a product of blood sugar issues. So that my weight at birth tells you that I was. And so I was just worried about that. I wasn't worried about my blood pressure. I wasn't checking my blood pressure except for at appointments. And, when I would take it before, it was always fine, like 100s over 50, 60, something like that. So it was really shocking to me when around 36 weeks pregnant, I started having the signs from people around me that it was going up. The first time the nurse took it, around 36 weeks, and she said, oh, I'm just going to go get a bigger cuff. And I'm like, okay. cool, no big deal. You know, I'm chatting it up with my awesome midwife and her nurse. And so the second time, around 37 weeks, so I was at weekly appointments at that point, she checked it and she looked at me and she goes, I'm just gonna come back and take it again before you leave. And I'm like, okay. Mind you, I'm a labor nurse. I take people's blood pressure on a regular basis and I do the same thing. So her games were not working on me. But at the same time, it's like nobody really ever told me what it was. So I was like, you know, I just sat down. Even nurses get what we call white coat syndrome, where you're scared of a doctor, scared of a provider. And, you know, I'm excited. I like my midwife, so we're chatting it up. I'm just thinking I'm a little too rambunctious, getting a little too crazy with her, joking around. So I'm going to calm it down and you're going to come back and take it. It will be fine. It's all good because I have avoided the nurse curse that I was supposed to have. So obviously this couldn't be an issue. Around 38 weeks, she took it and did the same thing, I believe. It was either a bigger cuff or let me take it again before you leave. Or she might have just not taken it until I was about to leave. So I'm fine with that. The other thing to note, if you've ever been pregnant, you know they make you pee in a cup every time you go to the doctor. They make you pee in this cup. And so I know what we're looking for. Once again, we're looking for protein, and we'll talk about why that's important here in a little bit. And I knew that I had either had negative protein or trace, where it's just a little bit, but I had never had more than that. So, you know, all this is going perfectly fine. And, you know, I knew that I was able to pee, which is good. I was not dehydrated, all good things. So at my 39-week, actually, let me back up. Before my 39-week appointment, this was a Saturday. I remember vividly laying in my apartment and getting this numb feeling in my arm, like my arm was numb to my elbow. So it felt like if you've ever had like carpal tunnel, it felt like I fell asleep on my arm, except for it was the middle of the day. And so I took my blood pressure and it was sorry, excuse me. It was 140/100. So yeah, 140/100, I took it. And I lay there for about 10-15 minutes because I know that if we take a high blood pressure, we're gonna wait about 15 minutes and we're gonna recheck it. So I rechecked it and then I proceeded to freak out because it was the same, 140s/100s. You know, that's a far cry from 120/70 and certainly a far cry from my normal, which was 110/60 or lower. So I called my midwife and I'm like, listen, girl, my blood pressure is this, my arm is numb to my elbow, like, I'm not loving it. I'm not loving this feeling. And so she put me on bed rest because we both knew I had an appointment on Monday. So it's Saturday noonish right now. I could show up in an emergency room and sit there and be probably sent home, or I could be on bed rest until the Monday when my appointment was. So of course I chose to just be on bed rest, which I was off work. I had worked night shift 4 nights in a row in labor and delivery up until 2 days. Actually, I just probably gotten off that morning. So that was my last shift to work. I had gotten off at 7 a.m. So I'm like, okay, you know, I am overreacting because I do that. I'm going to lay here and I'm going to let my husband do everything for me. I did not. And I'm going to show up to my provider's office on Monday and it's going to be fine by then. It's just stress and, you know, this baby's coming and all this good stuff. Okay, here we go, y'all. Monday, it was like 4 o'clock appointment. I had a late appointment that day. And I show up to my provider's office and the girl takes my blood pressure, the nurse or the MA, the medical assistant, takes my blood pressure and just puts her head down and walks away. And I'm like, I saw that. And I knew that my blood pressure had been high. So I'm just like, okay. So she steps out and I'm thinking she's going to come back with a bigger cuff or again to take it, you know, once I've chilled out. And my provider walks in instead and she goes, hey, so your blood pressure's high. And you know, we in the medical field, especially when we're talking to each other, we don't like to freak people out. So walking in and saying, hey, your blood pressure's high. Well, I knew that because I took it 2 days ago and I called you. So this is not shocking. And she goes, but you know, we can run some labs labs and we can do some urine tests and things like that. And I was at this point 39 weeks and 3 days. So I am 4 days from my due date. And I know, being a labor nurse, after 39 weeks, it is fair game. We can get this thing on, this show can get on the road right now. And that's exactly kind of what I said. And I hope I was nice. So if you're watching this, I'm sorry, because I probably was all kinds of crazy at that point. So I said, listen, I am not peeing in a cup or a jug. I'm not doing that. You can draw my labs when I come to be admitted tonight for my induction. And she was just kind of like, okay. So at 39 weeks and 3 days, I left. I went home. I called my husband, who pulled over on the highway and probably was like, you know, freaking out as most first-time dads do. And that's cool. We went to dinner. Nobody told me my blood pressure, y'all. Nobody. So I went to dinner. We went and ate and got some seafood at our favorite place here. And I showed up around 10 o'clock at night for my scheduled add-on induction for blood pressure issues. And one of my favorite nurses, who was with me pretty much the whole time, from being induced to delivering to all the stuff that I'm about to tell you happened to me afterwards, was my nurse that night. So, hey girl, good to see you. And she took my blood pressure when I got there, and I will not forget a lot of these things. It was 170 over 121. Yeah, so that is what we call the severe range. So a normal blood pressure, like I said earlier, is 120 over 70 or 80. Both of those are fine. Even a little bit higher than that, I'm gonna chalk it up to you're having issues with me taking your blood pressure because I'm scaring you, or you just don't like hospitals. All kinds of reasons why people's blood pressure would be elevated slightly. 140 over 90 is hypertensive, meaning this is how you get diagnosed, is the numbers 140 over 90. Okay, great. Mine was 170 over 120. Anything over either 160 or 110, so 160 for the top number, which is called the systolic, or 110 for the diastolic, or that bottom number, is considered severe range. And it can be emergent, it can be what we call a crisis. So when I saw that, I'm thinking, this is why I'm here. I'm not surprised anymore. And this is why my arm is numb, which we'll get into that also. So I'm like, okay, I also know as a labor nurse that most people, when they have blood pressure issues during pregnancy, they resolve with delivery. So great, we're gonna have this baby. This is gonna fix all my problems in life. Not true. So just to recap basically on these terms, chronic hypertension is if you have high blood pressure, so that's the 140s over 90s persistently, so over a span of time, either before you're pregnant or if we find it before you're 20 weeks. So that means if you come in, if you go to your doctor's office for what we call intake, so the first time you go after you know you're pregnant, and it's 140 over 90, they will ask you, you know, do you have any history of high blood pressure? You will probably say no, but how often, if you're not pregnant as women, or in general as men, how often are we taking our blood pressure when we're not sick, or when we're not at the doctor, or if we don't go to doctors? Not very often. So you're gonna say no, I don't have no high blood pressure, what you talking about? So we're gonna check it again at the next appointment, or we might have you check it again at home or at Walmart, wherever you go to check your blood pressure. And you're gonna come back and let us know, hey, it was still high. You are now deemed what we call chronic hypertension. You have it, basically. So that means we're gonna watch you very closely, but it also means that the doctor could choose to give you medicine for it or not, because basically you're coming to us with this pre-existing condition. So we can choose to treat that. And by we, I do mean doctors. I ain't treating nothing. I don't choose anything. We can choose to treat that or not, depending on how high it is, depending on if you have any other symptoms, you know, all kinds of stuff goes into it. At that point, you are what we call chronic, okay? So let's say you come in, your pressure's 110 over 60, maybe. I don't know anybody like that. But it's normal before 20 weeks. And then after 20 weeks, you notice it start to creep up. Well, we know as OB providers that your pressures should actually decrease when you're first pregnant, and then they should go back to your baseline. You shouldn't have high blood pressure even if you're pregnant. So we're going to be watching that. Now, obviously the slight elevation from pain of labor or, stress, fear, anxiety, we expect those things, but we don't expect it to be that high where it's 140s over 90s persistently. And if you have that happen after 20 weeks gestation or 20 weeks pregnant, then we call it gestational hypertension, which means hypertension in pregnancy, also known as PIH, which stands for pregnancy-induced hypertension. Those are the times when you'll probably see doctors order or providers order lab work. So you'll have extra blood tests. You could potentially have some urine tests done, and they could ask you to do what's called a 24-hour urine, where you literally carry your pee around in a jug, measuring every drop to check the function of your kidneys and to check and see if you have what we call preeclampsia. So PIH, or gestational hypertension, happens after 20 weeks of pregnancy, and it can happen until 3 months postpartum. That's usually shocking for most people because they will come back to the hospital afterwards because they have what's called pregnancy-induced hypertension, and they're like, well, I'm not pregnant anymore. Doesn't matter. You can have all of these things, all of these body changes until 12 weeks postpartum, which is virtually 3 months. So we get these people that get severe range blood pressures, which is 160s over 110 or higher. So either of those numbers, if you have higher than, those are called severe range blood pressures. Those can be emergent. That can be what we call a hypertensive crisis if it's more than just one random fluke. So what would happen then, if you show up to my unit and say, hey, I'm here because my blood pressure's high in the office, we will recheck it. We will probably do all of the labs that we will discuss in a little bit, and we'll let your doctor know, and we kind of go from there. And sometimes people come and they're like, I was really stressed out. I was running around with my other kids. I was, just trying to make it to this appointment. And as soon as I sat down, they took my blood pressure was high. Okay, we can buy that to an extent. But if it's persistently severe range, then we know that you either have what's called, you could have chronic hypertension, which is, you already had high blood pressure, it's just going higher. It could be PIH, or gestational hypertension, where you're post 20 weeks and now it's just getting out of hand. Or you could have what's called preeclampsia. So preeclampsia involves some lab work changes. It involves the spilling of protein through your urine. It can involve some signs and symptoms. It can involve a mix of all these things. It doesn't have to involve all of these things. The main thing is that your blood pressure is high, and it can be severe range where it's 160 over 110 or greater. So just to go back, if you've got severe range high blood pressures, the lab work that we do are called what we in the field called PIH labs. Easy enough. It consists of, typically it'll be like a blood count, a metabolic panel, some liver labs, because that can be affected when you have preeclampsia. We'll check your cholesterol levels. We would potentially check your urine for protein and creatinine, which are some kidney things, to check for kidney issues. And then, like I said, you might have to pee in my jug for about 24 hours. Now, you could potentially be admitted if we cannot get these labs under control, or if your pressures are still really high. Sometimes we can handle it on a clinical basis where you just show up back to your doctor every so often and get it checked. But sometimes you have to stay and get on some really not so fun medications, and all these things can happen to rule out preeclampsia. And once we know you have it, it's kind of like we're just watching you for it. This can also make you have to deliver your baby early. So not to scare you, but we want you to check your blood pressure so that you know, number one, when these things started, so that we can gauge what level you're at, whether this is chronic or related to the pregnancy, or if it's preeclampsia. So if you saw my post on my Instagram page at beyond.thebump, you saw the signs and symptoms of preeclampsia. So we'll have some severe range blood pressures, so 160 over 110 or greater. The most common sign that I see in my patients is headaches. And that headache is usually either really like right here around your temples or across the back of your head. And can be dull. It doesn't necessarily have to be sharp, but it's pretty persistent. If you take Tylenol, which is safe for most people, so unless your provider has said that you cannot take Tylenol, you should try it for your headaches. And it doesn't relieve your headache, then that's something that you want to get checked out for immediately. So obviously, if you got high blood pressure, you need to be checked out. But if you're not sure, you don't have a blood pressure cuff, or it's the middle of the night or anything like that, and you start to get this raging headache or even this dull headache that doesn't go away after an hour or two of taking Tylenol, then you want to wonder whether it's blood pressure related. You could have some visual disturbances or visual changes, mainly like seeing floaters where you see something kind of blurring your vision, but it's floating across your eyeball. Seeing starbursts where lights look more intense than they should. They look like they're exploding almost. Blurred vision in general. Obviously, I wear glasses. I'm going to have blurred vision. But if you don't and you all of a sudden have blurred vision, that can be related to your blood pressure. Numbness and tingling. I told you my arm was numb to my elbow. Like numb. Like you could hit it, it wouldn't change anything. Tingling in your feet, tingling in your hands. It could go up your legs or your arms. That can also be related to blood pressure issues. And then excessive swelling. I was really swollen. Once again, if you see my Instagram page, you saw my face. It was a pie, pretty much. My friends were really nice and decided against telling me because they probably thought she's gained a lot of weight. And they don't know. But I looked at this picture 4 years later and I'm like, I was huge. I could gain 2 to 5 pounds in a couple of days. And that's water. That ain't fat. That's water. So that's the swelling I'm talking about. If it hurts because you're swollen so bad, that's excessive. If you can put or have somebody else put their hand on you, like so, and then they release it and their handprint is on you, and it's like, you know, the impression is still on you, that's excessive. Swelling of your hands, feet, or face are serious. Obviously, you know, you're going to gain some in your belly. We expect that. But the main signs of preeclampsia are those things. So headache, visual disturbances, also right upper quadrant pain. So if you get a pain, a sharp pain, and obviously I'm flipped, so yours is going to be on this side if you have it. Right upper quadrant pain. So upper abdomen on that right side, that's where your liver is. That's why that's important. Because what can happen is you can get a liver that is swollen and angry, and you're going to have pain in the upper right part of your abdomen. So right below your ribs on that right side. That's something you definitely want to get treated for or seen for immediately. That's could be a big deal, okay? All right, so told you about the lab work. So we'll do what we call a CBC, or a complete blood count, a complete metabolic panel, a uric acid level, a LDH, which is a cholesterol level, the protein and creatinine, and then the 24-hour urine. Those are usually what we check for, like baseline. Sometimes we'll check it if you say, hey, I'm here, I got chronic hypertension. We might do those labs just to get a baseline. So we can say that we've seen a change. If you come back later and say, I don't feel good, then we can check those labs and know, wow, that's a big jump. Or no, that's not that big a deal. So we know, once again, how to proceed there. So anybody who has heard me talk about preeclampsia, I'm going to tell you what happens. I'm going to tell you why it's a big deal right now, starting right now. So consider yourself a Ricetrainer. This is my Ricetrainer story. For anybody who's heard it, you can fast forward. Ricetrainer. Your kidneys are your Ricetrainer in your body. Why? Because they basically filter all your blood. They keep what they want to keep, and they get rid of what they want to get rid of. So I'm making rice. I'm from South Louisiana. We always making rice. And I don't want the rice to go through the holes of my strainer. So what happens is, when you have preeclampsia, the rice is basically going through your strainer. So I've got my strainer here, and yes, I am a little ashy. Y'all, don't judge me. I've got my strainer here, and my blood is filtering through there. And what's coming out should be what you make into pee or urine. But instead, I've got so much blood pressure from having my pressures be so high that those holes in your Ricetrainer start to open up. And then your rice starts to flow out of it. And you pee it out, so to speak. So here's the analogy. Here's where it starts to make sense. In your blood, your rice is protein. So what happens is you go to the doctor, they check you every week. You pee in this cup, they're checking for protein in your urine. Because you shouldn't be peeing out protein. Protein should be too big to fit in the holes of your Ricetrainer, which are your kidneys. So your blood's filtered through your kidneys, and you should be able to keep your protein. So there should be no protein in your urine. Now, you could have what we call trace, which is just a little bit here and there. We don't really bat an eye at that. But if you have more than that, we're probably going to be watching you more closely and checking maybe some actual blood work. So you've peed in this cup, and now you've got protein in your urine. Hold on, my son wants to talk to me. He wants to hang out with me. So I told him, let me finish this. All right, so where was I? Peeing in a cup, protein, all that good stuff. All right, so you're peeing in this cup and you've got protein in your urine. We're probably gonna do labs. We might make you pee in a jug to see how much protein you're spilling in 24 hours. So if you've ever done a 24-hour urine, more than likely we're looking for protein. We could also be looking for what's called creatinine, which is a kidney function thing too. So most likely proteins first. If you have a significant amount of protein, so they check your number, and usually over 200 to 300, somewhere in there, they can say, yes, you're spilling enough protein persistently to say you have preeclampsia. Well, that number alone doesn't say, oh my gosh, it's emergent, let's go do something about it. It just says, hey, you got preeclampsia. We're gonna watch you. Yes, you can be watched. No, it doesn't mean automatic bed rest and hospitalization and everything like that. If you have mild preeclampsia, then we can watch you until it's no longer mild. And then at that point, your doctor may decide to put you on bed rest in the hospital, give you medicine, to help you with your blood pressure, or they may decide to induce, deliver, whatever needs to happen. So that will be between you and your doctor. I'm just giving you what happens. So back to my Ricetrainer story. So you're spilling this protein. So once we know you're spilling your protein into your urine and peeing it out, then we start to tell you more cautiously what to look for. Those signs and symptoms of preeclampsia. Headache, blurred vision, visual disturbances, numbness or tingling, right upper quadrant pain, excessive swelling, hands, feet, or face. That's when we start to really be like, okay, girl, you go ahead, girl. But also, I want you to take your blood pressure, once a week, once a day. It could range just based on how high your blood pressure is when we notice that you do have preeclampsia. And then the main other thing is, of course, if your baby's not moving. We want you to come in immediately if your baby's not moving. If you notice any vaginal bleeding, you need to come in, okay? So all those things are important. So why do you have all these symptoms? What do these symptoms have to do with I'm peeing out protein? Well, your protein's job in your body, so that rice that's supposed to not be strained and stay in your bloodstream, its job is to keep the fluid, that extra fluid that you gain because, hey, you're pregnant, it's supposed to keep the fluid inside your blood vessels and not out in your tissues. So when you have swelling, your fluid is in your tissues. And that potentially could be because you are peeing out the protein whose job is to keep that fluid inside the blood vessels and not in your tissues. But what happens is your blood pressure being elevated puts so much pressure on that blood vessel. So now it's a blood vessel. Puts so much pressure on your blood vessels that the blood vessels will start to crack. And once that blood vessel starts to crack, the fluid that's supposed to be going just in your blood vessels starts to ooze through. So now you're getting fluid out into your tissues, and that fluid can be in tissues all over your body. So the main thing we notice, especially as pregnant women, or when we're pregnant, is, oh, my feet are so swollen. That could be gravity, potentially. That could be just gravity and nothing else, which is why I want to know when you have swelling in your hands or your face. Your face should be not holding on to fluid. I mean, you can get a little bit from being pregnant, but it shouldn't be holding on to this fluid. So what happens is that protein that's not in your blood, because you're peeing it out, because your rice is going through the strainer instead of staying in it, you're peeing it all out, that protein. So those vessels are becoming injured and cracked, and you're letting that fluid out in your head. So now you've got facial swelling, you've got headaches that don't go away from the pressure, that added pressure. You've got visual disturbances because you've got extra pressure behind your eyes. So now your eyes are, the things that you see in the front of your eyes are going on behind your eyes for the most part. So that pressure is starting to affect your eyesight. Numbness and tingling, like carpal tunnel-like feelings. That extra pressure on your nerves will make you have numbness because you're having so much added pressure on those blood vessels from the swelling, because your protein is no longer holding that fluid in your blood vessels. Right upper quadrant is your liver swelling, typically. So that pain that you have in that right upper abdomen is significant because your liver can get really sick from preeclampsia, which is why we do those liver blood tests. And once it gets sick, it's kind of like starting to swell, and that could be potentially really dangerous. So if you notice that right upper quadrant pain, we definitely want you to come in like ASAP. Don't wait. Okay? So all these things start to make sense when you realize that the reason that you have all of these symptoms, or any of these symptoms really, is because you're peeing out your protein and you're not supposed to, which is why we check for protein in pretty much everything. We're going to check in your blood. We're going to check in your urine. Now, in your blood, we will notice that your protein is decreasing, while in your urine, we'll notice it's increasing. All of that makes up preeclampsia.